We know that men are actually less likely to have a primary care provider or family doctor. And even when they do have a primary care provider or family doctor, they're less likely to come forward with concerns about anxiety or depression or emotional concerns. And that might be more of a cultural or a historical thing attached to gender roles. But when we see people that we care about in our families or our friends, and they appear to be struggling, it's important that we have trusted relationships with them where we can have the freedom to say, you seem to be struggling. Is there something on your mind? Is there something you'd like to talk about? Well, I think the first thing is making sure that you're in a good space to have the conversation, that you're in a place where both physically but also mentally you're able and ready to listen. Part of it is also recognizing what you can and what you can't do. You don't need to be a physician. You don't need to be a counselor or a therapist. Oftentimes for those initial conversations, just being available and listening is what's most important. And if things start to exceed what you're comfortable handling, or what you feel is within the realm of what's appropriate or safe based on your relationship to be hearing, having a sense of where to reach out for further help is a good idea, and can often make those conversations less awkward. When you're concerned about someone you care about, you might want to have the conversation with them right away, but it's important to take a step back maybe and think about, is this the appropriate place and the appropriate time? You don't want somewhere where there's not a sense of privacy. That being said, when there are emergent concerns, when things are really troublesome, reaching out and just in the moment and just kind of saying, how are things going? Is there something I can help you with? Can be a good segue, and then maybe finding a way to take the conversation elsewhere.